the seminar of our college. And today we are very honored to invite Dr. Shabbir. He's from India. He's a deputy of our institute, the Institute of Biomedical Informatics. And he will give a talk about the transforming healthcare from evidence-based to intelligence-based medicine. Also, that's welcome, Shabbir.
Okay, thank you so much, Professor Terry Fu. And my colleagues, ladies and gentlemen, it's my honor to present my views on the research which we are doing in our department, that is Graduate Institute of Biomedical Informatics. So let me start with very basics. Let me give small background of myself. As you see, I was born in India and I got my medical degree from Russia, and I got my master's from Norway and PhD from Thailand. So yeah, I was going around. And if you see, after Taiwan, I am not going anywhere. And the reason is I like here so much, I like people, I like country, so I am happy. Okay, then go back to our topic. Before going to this, I just want to have some brainstorming of what society we are living, what's happening around us. So here is our fourth innovation in health industry. But I would like to know from any of you, what was the first human invention which changed our life? Not only health, it changed our life. We live on earth. Anyone? Any guess? What is the first invention of humankind which changed our life? Huh? What? Tools? Little bit, but that tool is not, there are many tools.
Lamp.
Huh?
Lamp. Lamp.
Light?
Yeah.
No, light comes very often.
Fire.
Huh?
Fire.
Fire, yes, I can say yes. But in respect of our health and life, I say agriculture. Agriculture was the greatest invention of humankind which changed the life we are living. And it changed the even locations, geography, everything it changed. That was agriculture. Then, now we are talking about modern inventions of healthcare. So, if you remember, what is this? Of course, you know. What is this? X-ray. Yeah, lung X-ray. I am not going into the reading of the X-ray. This is X-ray. X-ray was actually not invented. It was discovered by chance. And it was in late 19th centuries. I don't know what I did. Okay. Late 18th century, 1895 something. It was William Röntgen, who accidentally found when his experiments some rays are passing and which are crossing, penetrating the thick books. That was his attention. He told what's happening. Then ultimately he found it even crosses lot of different objects which are cannot see by eyes, and ultimately he found the rays can penetrate our skin, but it cannot penetrate our bone. That's how we started using X-rays in healthcare, and it changed a lot of, before only we used to see the body, but now we can see what's happening in the body and all those stuffs. The next biggest invention, antibiotic. What was the first antibiotic? Penicillin. And you know that is also was a discovery, not invention. And penicillin was discovered by Alexander Fleming, and he was not so careful guy. He was careless guy. He don't used to organize his things. So he kept all his dishes. He used to work in microbiology in Germany. And he kept all his things in lab, and he went for holidays. for 2 weeks. When he came back, he saw some fungus and which he clarifying and killing all streptococcus bacteria. He saw what very curious. He saw what's happening in this dish. Then ultimately he found this is penicillin, which was remodified or redefined into penicillin. And our third, this is like 18th century, 19th century. In 20th century, we started using CT scanning, MRI scanning in our healthcare. That I can say as third invention which changed our health industry. But now we are talking about digitalization. We are talking about health information technology. We are talking about artificial intelligence. That is the issue. So that is the reason why we are sitting here. We are discussing about how we can improve our healthcare from evidence, what we used to do by using artificial intelligence. And before going to the problem, I would like to emphasize, these are my own issues which I think which we can really handle using artificial intelligence. One is participatory health is ignored. That is our key issues. So, but I would like to know what is participatory health, by the way. What is participatory health? Patient involving in his own health care. That is participatory health. Now what we do, patient comes to doctor. By the way, I am a doctor, as you know. What usually doctor do? We sit in our table, patient comes, we see, we write and we give him. And he go away. Take medications and whatever happens, nobody will care. That's the reason we don't want that. We want to explain patient what's happening with him. See, you got infection. Now I am writing you antibiotics and it is 5-day course. You have to take it 5 days, 3 times a day. You cannot leave it after 2 days, after 3 days when you feel better. See, difference is there. Now I am empowering the patient. Then I am explaining him. If you drop your medication in between, then next time I cannot prescribe you this antibiotic because your body will be resistant to it. By the way, how many of you know what is superbug? Superbug. Superbug is a resistance to any type of antibiotic available in the market. I'm not talking about Superman, superbug. It is more worse than HIV/AIDS. We have cure for HIV/AIDS, but we don't have cure for superbug. Why I am talking about that? Because if you don't empower your patient, he misuse or he don't use effectively the antibiotics you prescribe. Next time he comes, you have to give higher antibiotics, same thing repeat. So one day, now antibiotic will be working on him. That is the situation called superbug. Okay. Another important focus is on curative care. As I told, still we wait for patient to come to us and tell his problem or her problem. Only then we will start taking care of him, which is bad. We have to go more towards preventive care. I will show how AI is helping us to go towards preventive care. Then another thing is medical error. You know what is the first principle of a doctor? That is the basic principle of any clinician or any doctor. Okay. How many of you are doctors? Only I know Professor Terry.
No, I'm
No.
not.
I know only one doctor is there, I suppose. Okay. So the first principle of doctor is do no harm. That is the first principle. But unfortunately, medical errors or medications error are top 3 causes of death, causes of high casualty or what to say cost wise, unfortunately. So it's like you go to any hospital for care, high chances are there you may get misdiagnosed, you may get mistreatment, you may get some wrong procedure. This is bad, very sad, but this is true. And this is not my opinion, this is research, what is talking about these things, about medical errors. And another worst thing is, one size fits all care. We consider all human beings are same, and we prescribe same treatment for everyone which has same problem. Again, which is wrong. And same thing applies for clinical values, I mean to say lab values. Same thing, 5 years male, 50 years female, we have same reference values for hemoglobin, for neutrophil, for monocyte, for neutrophils, for bilirubin. I can talk all these things. I hope everyone agree with these problems. Good. Then comes, what is natural intelligence?
Human brain.
Human brain, but what it is?
Something that's innate or personal.
Innate, taking decision. Actually, intelligence is all about how you analyze your problem and make decision. That is intelligence. That is natural, how body works. Then comes, what is artificial intelligence? Huh? Exactly. We want to teach computer to become like a brain, to take decisions like a brain, to make analysis like we do. Right? But then my question will be, third question will be, why we need artificial intelligence when human beings are there, when we can think, when we can decide, why we want computer to decide on behalf of human beings? Any reflection, please?
Because we have biases.
We have biases, very good. We want to sleep, we want to eat, we want everything, life. And most of the, we get, what to say, tired, right?
Yeah.
This is human being. We get tired, and there are many things like repetitive things, which can easily be handled by the computer. So we don't need, meaning that is the one of the key reasons, but there are much more important reasons we will be discussing right now. What is this?
Neuron.
This is only one, actually it's cluster of neurons. So you people are good artificial intelligence guys. Good. And what is this?
Neuron.
This is a cluster of neurons, and this is one single neuron. So how many of you know about neurons? Please raise your hand. How it works? A little bit. Yeah, little bit. So no, the reason is it's very important for us to know how neuron works before we go to creating artificial neurons in our computer. That is the point. But the people honestly, they don't even know there is neurons in our brain. They think brain is working like brain, okay, and I want to make artificial intelligence. This is the thing. I'm not talking about you people, I'm talking about internationally all over the world. This is what is happening. And just I want to add some things. These are called dendrites, these endings. These are the things where the neuron get the signals. And this is called axon. It processes here and it passes these signals, what all it collects to the next neuron. And this continues endlessly. This is exactly what we are trying to do. Maybe you are familiar with this chart showing deep learning, artificial neural networking. But why? How? Because of this. You give all inputs here, and all inputs are connected to all possible variables, and we are seeing, okay, from input, this neuron got one signal from here, then it passed to this. In that way, we are reaching output. So what happened in computer is very good at memory. Once we give various levels of, see, this is for one patient, one case, and we give age this, gender this medication, this diagnosis, this blood value, this, all this we put, which we call it input variables. And then we forget, we don't need to know anything this. Here we have, okay, he is diabetes, he is hypertensive. We can classify according to our need, according to our data set what we have. Then what we see is, in supervised learning, we teach computer, if you get this value here, this is your output. For second patient, if these are the values, this is your output. And you do that for hundreds and thousands of times, not one time, not two times, not three times. Then all these things, computer memorize. Okay, if this is the value, this is the value, this is the value, this is my output. So this is exactly how things work in artificial intelligence. Then as I told, I talk about 4 issues. So I will take concretely these 4 issues and tell you how artificial intelligence will be working in these 4 different issues. One is participatory health. As I told, what is how we can improve or how we can promote participatory health? By empowering patient, by involving patient how to take care in his own healthcare management, by giving him more knowledge of his own disease or his family's own disease. How many of you know about this? Please raise your hands. I see only one, the 2 foreigner. You people don't know? My husband? Then please raise hand. Yeah. And you don't know what is this? Please, you should Google it right now. You should learn. Then you should go and register yourself. This is fantastic project from government of Taiwan, that is National Health Insurance Bureau. No one in the world does what this project is doing here. It literally provides all your medical care to yourself. So this is my health bank. That's why I wrote in Chinese also, so that you get. So you use your card, you register yourself, and then you get all your data which you went to any hospital in the Taiwan. And that is not all. I can show many more things. You can add more values. See, these are the dates where you are going. It goes to clinics, you can go to dentist, you can go to Chinese medicine, everything will be there. Everything will be there. And you can write when is your next visit, when is your vaccination day, all those stuff. And also you can write your physiological measurements like your blood pressure, your heart rate, if you are walking, how much you are walking, all those things. You can write your vaccination information and check the test results. Each and everything can be done here. And another important thing is, this is not all again. They have one best function I can say. That is, it tells you what are the diseases you are going to get. Because the database already you know your age, your gender, your past diseases, your current medications, your past medications, your blood reports, everything is there. So it's very easy to use artificial intelligence to make data analytics and come up with a prediction. This is very important. But one drawback of this is it tells you your 10-year prediction, which is not very much useful. Therefore, one of our students in our lab has made it up to 1 year prediction. I will show that later. But anyway, this is what. Once we know what to say, what is your health condition, what are the diseases you are going to get, then I suppose it's much easier for you. If you are really concerned, worried about your health, you can make appropriate changes in your lifestyle, in your environment, or in your whatever these things, family. Then try to at least prolong the disease, absence of disease.
Voicemail 2 points. Ding ding mail.
Yeah.
2 points.
0 points. For liver cancer, this is the fact.
Okay.
Males are more prone to get liver cancer than females.
Okay.
That's why they made this point system. And as I showed, here you can write all your blood pressure, heart rates, and what all you want to do in your breakfast, lunch, or whenever you want, all those things. And this is what I told about hepatocellular carcinoma. The student which we studied in the lab is how to prediction of this thing. But before going to the prediction, I think this slide is very important to explain from where we are collecting the data. This is our birth. Right from the birth, we come up with these 3 things. One is genotype from our parents, then is environmental, where we born, the chances of getting more infections in Africa, or chances if you born in Switzerland or even in Taiwan. So it's all depends where you born and what genetic you have. Added to that, it will also play important role your behavior. When you are getting up, how much you are sleeping, how much you are eating, how much you are running, how much you are taking care of yourself. So these things all form who you are. You can not change anything here, but you can try to change this little bit, and this is completely in your hand, because it's up to you how much exercise you want to do. It's up to you how much food you want to eat, what type of food you want to eat, how much alcohol you want to consume, how much cigarettes you want to smoke. Everything is up to you. Depending on that, you become healthy or patient. Once you become patient, then you enter into this circle. You will have patient profile, diagnosis, problem, procedures, medications, lab results. All these things are numbers, values, data which are collected in electronic health record system, which can be again analyzed and come up with various different things which we want to solve. And this is exactly what happens. So once we get all this data, then it can be like early detections, or actually it starts from the prediction. We can even predict, okay, your parents, your father had lung cancer, for example. Patient A, father has lung cancer. So for him, getting lung cancer is very high. That means he should not smoke at all. Even he should not have friends who are smoking. That is the way. Otherwise, he is likely and highly prone to get lung cancer. This is just an example. So early detection. So when we know, okay, you are the candidate who are more likely to get cancer, then we should early detect. Because early detection, less pain, less money, less time, less treatment. And if you prolong, everything doubles, triples, or exponentially increases. Same thing, all this goes like that. So this is the whole set of data set. Then come about predicting cancer. So we already explained, once we predict cancer, then we can try to change his lifestyle. We can try to modify the medications which are prone or which may cause cancers and all those things. Here is the main reason. You see, 10 years is too long to take it seriously, and 1 month is too short to respond to it. Because if I say next week you are going to get, or next month, practically you can't do anything because almost it's decided. Therefore, if you have 1 to 3 years in advance, definitely you can work and improve your behavior in order to prolong or eradicate all this cancer. Now I talk a bit about CNN, because he used CNN as a tool to analyze the data. We need to know, okay, I can. What is CNN, by the way? Not news agency, I suppose. Right? What is CNN?
Convolutional.
Yes, convolutional neural network. But honestly, nobody knows what is convolution. How many of you know?
It's just a general term. When you say convoluted, it's like, it's not a simple network, but there are so many ramifications. It's like very complex.
That is, yeah, one way I agree with you, but actually the literal meaning of convolution is merging things.
Okay.
Merging things. So what we do here, usually CNN is used for image analysis. So I will give one best example of how this works. So you provide your computer with thousands of, what is this? Cat, right? Because we see our brain analyze, it is cat, and we say it is cat. We see our brain analyze, we say it is dog. But how tough it is for computer to see and say it is cat or dog. So this is nothing but pure image analysis. So I will give you one example. If you show the cat, they will see, okay, they see these round points, they see these holes, they see structure, the pattern of these. So it's not one cat. You cannot show one cat and ask for another cat. Computer will not give. You need to give thousands, 10,000s or maybe millions of cat pictures of different angles, different positions, different looks. Maybe cat is looking up, cat is looking down, cat is scratching with leg. I don't know, there are thousand sleeping, playing, whatever. But the computer has to memorize all these bit by bit structure of that image. Then only when you give the new image, then it says, ah yes, it looks more likely to cat. Very simple. But it's, you see, it goes through all different patterns. At the end only it gets cat. This is exactly what happened in convolution. You put this, they say structure, they see eye, they see nose, they see different patterns. Then what exactly we are looking, which pattern, that gives one answer for it. This is the patterns. You see, it looks for the structure at the corners. How it is defined, well defined, or it is straight line, or it is round, or whatever. By seeing this, the computer will learn. This is convolution layer. This is what I was talking about. This is pure mathematics, and that too complex mathematics. How these values we get from the images, and that we get from the pixels, and that we get from PRG, I suppose, red, green, blue values of each pixel and neighbor pixel. And they merge them and make this table, and this table multiplied by the next table. In that way they make a complex matrix in order to reach to one conclusion or to reach to one pattern. This is how we'll see, this is how computers see. This is how we see, this is how computers see. Depending on this, computer will tell you what it is, dog, cat, rat, whatever, this thing. And this is exactly what we try to do in our lab by using ICD-9 codes and medications to predict hepatocellular carcinoma. And this is how it shows again. Now I am showing in Chinese. And this was the data source: outpatient, inpatient, medication. This all from 2 million clinical data source they have. So definitely we don't want to go in details. Just to give a general idea what data we collected, what were our inputs, what were our outputs. So we also had some long-term drugs, ACT codes. So this is how it looks. The patient start drugs, this diagnosis, then these drugs, then they did not get cancer. But these people use this drug and this diagnosis, and then they got index date, means when they were diagnosed as carcinoma. And this is how again it works. All these are inputs, then hidden layers and output. Cancer, not cancer. As I told, it is all about matrices. I think this is good. He managed to get accuracy of 0.88 and 91 around 2 different time levels. This is maybe for 3 years, this is for 1 year. Meaning, before you get cancer, the system will say you are prone to get cancer 88% with accuracy. And 1 year ahead, 91% accuracy. Yeah, same thing it shows here also. So basically, what I want to say was, we can make prediction models, but there is one problem. Problem is this: preventive care is hard to convince. If I say drink water, Evian water every day, you will not get cancer. For example, because this I brought from Himalayas. This is very holy water. If you drink it, you will not get cancer. So imagine you started drinking. Imagine. So how much time you should drink? 1 year, 2 year, 3 year, 5 year, 10 year? We don't know. Till someone get cancer maybe. Even someone get cancer, it's not necessary this is curing or not. So in short, what I want to say is, it's very much hard to provide scientific value for predicting things or prevention methodologies. And repetitive and slow, since there is no pain, so you really don't realize whether it is because of water or not. And also, that is exactly why making it low market value. That's the reason why insurance companies really don't want to invest on prevention, because they really don't see what is really working, what is not. So simple thing. Even if I say exercise is very good, everyone knows exercise is very good, but nobody can give me a guarantee if you do 20 minutes exercise, you will not going to get cancer in your lifetime. Can anybody can give? No. Nobody can give. That's how it works. Then coming to second problem, which is medical errors. It will be a bit faster because we have limitation of time. But anyway, top 5 causes, this is the top cause, horrible. After cancers, medical errors are the things which are making worse. And then what we can do, how we can predict or make models for medical error is because of our data sets which we have. Okay, if the patient is going this medication, then he should not go to this procedure. We all have this connectivity, dependency among each other. Once you put all these things into system, then the system will send you reminder. If the patient is on warfarin, you know what is warfarin? Who make blood thin, and it's high chances of bleeding. It prolong your clotting time. So you cannot go procedures like endoscopy or colonoscopy, stuff like that. So every time there are contraindication and indication for any procedure and any drug. So in that way we can do. So what we did was we analyzed these 700 million prescriptions. Each prescription consists of set of diagnosis and set of medications. We put this into system and see if this A, B, C, D is diagnosed, what are the chances of medication? What are the different medications are commonly used or used in practice by the physicians? So if some physician use some wrong, so this is the alert it gives. For this type of diagnosis, this medication is not commonly used. The system never says it is right or wrong, just remind the doctor saying that if you use this diagnosis, this is not commonly used drug. And another problem with medications is same name, totally different action. It looks very same, they can confuse, but it has totally different effect. Then also the system will alert them. For this set of medications, this is not the medications you prescribe commonly. Then personalized prevention. First of all, what is prevention? Simple. Prevention. What is prevention?
Stopping from coming.
Prevent to get ill. And what is personalized prevention? That's tricky. What is personalized prevention?
It would be, maybe it would be based on the probability of a certain disease for you to acquire, and then you target it using personalized approach.
That is what? Meaning, I don't just stand and say exercise is good for everyone, do exercise. My professor don't need so much, he is not obese. Maybe I need more exercise than him. So I should say, I should do more exercise. Maybe he should concentrate on more nutrition. I don't know. Or, no, sorry, this is just simple example. This is personalized. He should eat more. So I should eat less. Right? So we need to personalize. Then only people get more interactive. If I give saying like, okay, you should not smoke. Come on, everyone knows we should not smoke. But so what? But if I say, no, you have high risk of getting cancer, your brother has cancer, this has cancer, and you are living in this area where it's high polluted, so already you are highly prone to get cancer. So please don't add more risk factors. Right? So that is called personalized. And that is exactly all fit, one side all fit medicine. This is what we are trying to do now. We use same thing for everyone, same values for everyone. And you see, lot of things are incomplete. How many patients don't know about allergies? Many patients don't know. And how many don't know their family history? Obviously, I don't know how my grandfather died. I never saw him. So I don't know what happened to him. Grandmother, what happened? My grandmother, I don't know. Grandmother's sisters, I don't even heard about her. This is real problem. So we have a very limited history of our family, which is incomplete. And all this behavior, environmental data is not available. When a patient comes to me, do I know which region he lives? I may know his address, but I don't know what is the environmental condition of that area. How much pollen are there, how much pollution is there, how much carbon monoxide emission is there, all those things. So we have very limited. So we do generalized treatment. That is what I wanted to say. Therefore, we are trying to, this is the project under progress. We actually discussed with Professor about this. What we are trying to do is, we are sequencing diseases. Because in our life, we get several diseases in our lifespan. Like disease. This is all each patient, each arrow is each patient. Okay? And then what we want to see is, we want to see in this given period of time, say for 3 years, what diseases this patient would get. In 3 years, what, some may get 1, some may get 2, some may get 10, some may get 15. Then at the end, we have data of 23 million population. Then we aggregate and see what are common patterns. If A, B, C are occurring together in many patients, or K, L, M are occurring together, how it's sequencing. Then what we are trying to do is, we are correlating with age and gender, because diseases, comorbidities changes by age. By children, it's totally different risk. For example, if 5 years obese patient comes, boy comes to me, his risk of developing diseases, next diseases are totally different from 60 years female obese patient. These are totally different people. Although that disease is same, he is also obese, she is also obese, but risk factors are totally different. That is how we want to go personalized prevention. Once we know this data set, once we know what is going to happen with the patient, we can very easily early detect or even predict what is going to happen with the patient in the next. So this is how exactly it works. A, B, C or A, K, L, whatever. Then we have like time limit for this. And what our student is doing is, he's actually working on all variety of algorithms available. What are their inputs, outputs, what are advantages, what are disadvantages of each. Then we want to use what is fit for us in our data analysis. So these are like different these things, and we need scalable because we have huge data. We have millions of patients. So we cannot use things for 10K or 100K patients. Then we are assuming our end product will be like this, showing, okay, for this 0 group means 0 to 9, 4 means 40 to 49, 7 means 70 to 79. Male, female, it can be 20 groups actually, 10 age group interval. And then we can say in each age group, what are the disease occurrence patterns? What disease occurs together in each age group and gender group. And it can be not only first, it can be like 5 common patterns of diseases. And each pattern consists of more than 2 to 3 diseases, not one disease. In that way, we are trying to predict personalized prediction and early detection. So almost I have finished. In conclusion, especially in Taiwan, health IT has been a key factor for healthcare success, efficient healthcare, and AI and healthcare can go in hand, definitely. As you see, in every topic and everywhere we can use AI effectively, efficiently, so that we can come up with best practices. And then AI can help on QPS, that is quality and patient safety. Once fit side and prediction and prevention can be done. And definitely, as I told in the starting of my lecture, things which change our healthcare, the innovation. So AI is the fourth innovation which is going to change the way we are practicing medicine. And definitely my thanks goes to Professor Jack, and Lieber is the guy who worked with cancer disease, and Vitali is from Germany. He is an exchange student in our lab. He is working on sequencing disease patterns. Yeah, thank you. So I will be happy to take questions.
Okay, thanks, Dr. Shabbir. So, any comments or questions from the audience? So we have many students, so very welcome. So would you provide some feedback?
Here it is actually, yeah.
Yeah,
I'm
okay.
not student, but can I ask you a question? First, for the prevention medicine, would you suggest the doctor, if the physician comes to the regular clinical examination, will you suggest the doctor to examine what you have, the prediction model to see?
Once exactly. So once we develop it, once we publish it, once we convince our research community, okay, this is working very well, and we need to give probability. So
But how can you do this kind of clinical trial? Because
no, I am not doing clinical. I am doing retrospective analysis of the data.
yeah, because you base on the record to
Yes,
develop
exactly.
this machine.
Yes.
And but in reality,
Yes.
when the patients comes in and you input all the medical record into your machine, and maybe you say you may get
No. I don't need to put anything. Once the patient comes, I know his age, I know his gender, I know what is current disease he is having, because I am treating the disease. That's all I need. I don't need to do any analysis. Then I go back to my algorithm or my results. There are already patterns designed, meaning for this age, for this gender, we say hypertension is the disease.
Okay.
So he is going to get kidney problem. Next thing I need to focus for him is kidney problem.
Okay.
Then I see, okay, I don't wait till next time or after 2 years he come with kidney problem. I know already he is male, he is X age, and he has this disease. So he will be getting these three diseases are high risk for.
I know, but my question is the sensitivity and the
Specificity, yes.
Yeah, because before you do this kind of apply this machine to the patient,
Yes.
you just test it based on the database.
Two things I need to say. I am not saying you start treating him.
Yeah.
We are not treating him. We are just providing indicators to the physician.
Yeah.
See, this guy is going to get kidney problem.
Okay.
Then what he should do? He should not prescribe drugs which will affect on his kidney. He should not prescribe diet. He should say him, you should not take this because this will affect on your kidney. We are preventing. We are not treating.
I know.
So it has nothing to do with how accurate or how accuracy, because this is all probability of this age, this gender are usually getting these diseases in common. So definitely you may get this. I am not saying you will get this.
Okay, I see. So maybe that's my bias because I'm doing the cancer research. As you know that in our university we have the IBM Watson oncology system.
Yes.
And you just input all the information of the patients and you got the recommended.
This is not that. This is not that. This is already pre-designed algorithm or results. Just we need to follow what it is there.
Yeah.
Instead of now I got. You are saying okay, I am making another Watson. No,
Yeah.
I am not making another Watson.
I just because this too equal to
Yes,
this,
I understand.
AI system.
Yes, I agree.
maybe can I say something? Well, Chris kept pointing me, so I feel like I need to say something. Sorry, I'm just kidding. Yeah. So I think what is working on is like the my health bank health passport. Sorry. Yeah, the sort of thing like predicting your risk factor in 1 year, 3 year, or whatever. Yeah, I think this is what he's doing. So. Well, there is a certain difference between probability and how certain that you will get a disease. So yeah, so I think this is what he's trying to say. Yeah, and
because sometimes if you tell the patient that maybe 2 or 3 years you may get liver cancer.
Yeah,
it will kill you.
We need to be careful in that.
Exactly. I know, definitely we don't say them, but we can alert them like indirectly, or we alert ourselves. I don't need to give him medications which will affect on his lung. One. Number 2, it is not bad for me to say, please you should stop alcohol, otherwise you have high risk of getting cancer.
Okay, let's see.
That is again nothing to do wrong. That is ethical, and it is my duty.
So don't do treatment based on probability.
Exactly. I never say we are doing treatment. We are saying early detection and prevention. No early treatment. No.
If I may add, what your current work would definitely need the active cooperation of the hospitals and the clinics, because technically there's already like high risk or high probability of acquiring those diseases. Basically, you're just the patient would just be under monitoring, right? So probably the hospitals can create different programs that can inform the patient more, and then they can have like different activities that can support. Because
very, very good question.
Okay. And then one more thing is that because once the patient has been alerted, surely that's a trigger already. And majority of the time, the patient would feel a little bit anxious about it, because most of the patients cannot sleep. Oh, I'm going to have this disease, blah, blah, blah. So in connection to My Health Bank, the next question I would like to confirm is that kind of program is really very good. But I want to ask, do they also have like a segment or a section wherein there's a patient support system? Because you can already see the prediction and high probability of like liver disease, but on a general condition, on that application, can we put also like general guidelines on how the patient can easily address, or simple tactics to address, to prevent it?
Definitely, that will be progressive thing is going on. So let me reply to your first question. Like if I do something, it's not enough. It has to be used. End users are the physicians in the hospitals, not we in the lab, right? For that, my answer is, once we manage to publish this, I don't need to do anything. It will be the National Health Insurance job to see, wow, this guy has done a good job. Why don't we put this in our hospitals? Once doctors know what is going to come, they can prevent it. Then they don't need to spend money further. So that is one thing. The second thing what you told is, it's not only enough just to tell the people you are at high risk of getting cancer, but also to provide more information, how to avoid this, how to change your behavior, how to eat, what to do. I totally agree with you. Yes. Please.
In my opinion, I think how do you use this predict liver cancer, and how do the doctor to understand this and accept this for him to do the diagnosis. So how to use that, and do they think this do they accept these opinions?
You mean doctor will accept this prediction model? Okay, two things you should know. This prediction is done by a doctor.
Yes.
Number two, this prediction is done by the data, clinical data of that patient.
Yeah.
So there is no point in accepting or not. If doctor is smart, he will accept. No, honestly, if he say no, I don't want, then it's up to him and his patient.
Also, I'm not sure if this is like, but I think this because if you have the data already, because all of the doctors, all of the healthcare providers have their own different approach, right?
Yeah.
They have different mindset.
Yeah.
So my concern is that surely this will happen. I believe that before the hospitals or the healthcare providers implement this your application is really, really helpful. They should really have a rigorous structured course or training on how to deliver it to the patient.
Very good.
Because
Very
that's
good.
what
This
could
was
cause
my
this problem.
ultimate thing.
Yes.
The way we are training our medical doctors are wrong. I told you, yeah. Because we treat by systems. Circulatory system is independent from digestive system, from nervous system, from musculoskeletal system. But in body, diseases doesn't occur independently. They occur in combination. So they are, that is exactly what I want to focus. You cannot just treat them hypertension, and for liver you send to another building, another department. For eye you send to another doctor, another department. And these three doctors treat one patient giving different medications. Poor patient has to take all medications without knowing what is treating for what. This is our current way of practicing. Therefore, once we get this patterns of disease, then our education system should change. We should personalize our treatment. If males come with this age, for this disease, this should be the approach. If female come with this disease at this age, this is the approach. But now our approach is disease oriented, not patient oriented. That is what I say. Now we treat diseases, we don't treat patient. But we should treat patient, not disease. Ultimately patient is important, not disease. Correct.
Yeah. I have two questions. The first question, is this a view that you will see from your window, office window?
No, this is from Elephant Mountain. Elephant Mountain. But I have not taken this picture. But this is from Elephant Mountain.
Right. This you can see from your window. That I'm envious.
No, from my window it's also very beautiful view, but not city, but park, lake, all those things. I like my view.
Alright, okay. Second question. So, in your convolutional neural network model training sort of thing that you have mentioned that you put the ICD code and you also put the drug information as far as I remember.
Yes.
And then this is the on the y-axis, x-axis, whatever, and the other axis is the time, and you use that to do the convolutional thing. So convolution is really about merging, or maybe I can say compressing.
Yes.
Yeah, compressing information, 1, 2, 3, 4 layer. But in image network, well, the reason for compression is that they can really to make some of sharp things into some kind of fuzzy representation. So for image purpose, at least for image purpose, it is the closely related pixels that are being compressed. So I wonder if you also did the same thing for your ICD.
I honestly say this was the first thing which I came into mind when I heard this project. When he use CNN, because for me CNN is all about image processing,
Right.
not this. Then how he explained this, he explained like this.
Okay.
So, okay, because of time limits.
1 minute.
Yeah.
I want to, I cannot go this. So he used this chart. He used this chart like sort of image. Then he see this one means the diagnosis there.
Right.
Then you see here all these diagnoses there. So he converted this into sort of image things and started process.
Okay.
Now yeah, very good. Okay, thank you.
Okay, thanks, Dr. Shabbir, and thanks the